इसमें ट्रैप खोलो जरा।
So dear doctors and students, a very warm welcome on this Homeopathy 360 webinar platform. We again ready for a new session with some excitement and some informative points in this webinar. Kindly stay tuned. We in a minute start the sessions. We bring our presenter and we will start the proceedings for the webinar. Stay tuned, please.
Thank you so much, Dr. Rajesh sir, for the intro. Uh, I would like to welcome everybody. Good evening, everyone, and welcome to today's webinar by Team Homeopathy 360 in collaboration with HHF Hahnemann Homeo Forum. So before we begin the session, let me just welcome you all to the session. And while everybody settles down, I just want to introduce you to the platform of Homeopathy 360 as well as Hahnemann Homeo Forum. So I would just, Dr. Yashika Arora, would like to tell you that first about the HHF. HHF is an institution and home to every homeopath where they try to grow each other together. They believe in working, supporting, and prospering together. And they hold very regular communicative academic sessions, seminars for students and practitioners. And again, they are here for a 5-day series, which is being started from yesterday only. So they are here to share their knowledge and their experience with the fraternity. The modus operandi of HHF is interpersonal relationship. And now today we will be studying how you can study materia medica, the live behavioral materia medica. This session is about. So welcome everyone to the session. Also, I would like to introduce you to the platform of Homeopathy 360, which is an online platform for all kinds of publications, like articles, research papers. We have journals like Homeopathic Heritage, HomeoBuzz. We have latest news, latest updates, all about homeopathy on just a single website, that is www.homeopathy360.com. So I would request everyone to please visit the website and contribute by submitting articles or any form of research papers you have for the benefit of the fraternity. Also, I would like to introduce you to the homeopathic learning series, which will be beginning tomorrow. Like, we have this series going on from 6 to 9 p.m. with HHF. We are again starting Homeopathy 360 homeopathic learning series for the coming 30 days. That's starting from tomorrow. You can visit the website for the same. I'm just putting the I'll just put the link of that website page wherein you can register for the learning series, where the best faculty, best teachers would be participating for the webinar, and they'll be discussing on each and every aspect of organon, materia medica. We'll try to cover each and every aspect as master has guided, Master Hahnemann. So we have best faculty. Tomorrow is the session of Dr. L.M. Khan sir and Dr. Yogesh Niturkar. You can find all the details of tomorrow's series at this link, which is being posted in the chat box. So you can visit the link and then register for the same. If you have any queries, you can mail me at webinar@homeopathy360.com. And now, without wasting any more time, let me introduce you to the speakers of today's webinar, plus who will be the speakers in the upcoming days. I would also introduce you the same. Today we have Dr. Mayur Mahajan sir, who is one of the leading homeopath of Thane and is a keystone in the bridge called HHF Hahnemann Homeo Forum. And he has so much knowledge. He's an excellent clinician, and he's one of the dashing personalities from the group of HHF. So his excellent clinical skills, added to his deep theoretical knowledge, blended with his intermittent and spontaneous humor, is like which keeps the audience asking for more and more things again. So we have him here. Sorry. So we have him here today. Also, we have Dr. Alok Kumar sir with us, who is offering worldwide medical services in India since his return from Belgium in 2011. I'm so sorry. So we have both of them here. He has received the VLIR award in Belgium 2008. Without wasting any more time, we'll welcome him. Also, I would like to announce the upcoming day's webinars. So we have, I'll just show you the screen. We have tomorrow. So we'll be having tomorrow the session of Dr. Yogesh Rajurkar sir and Dr. Sri Krishna Dhafle sir. They'll be discussing on exploring man with via his interplay in the domestic, occupational, social, and environment. So he'll be discussing aphorism 5, its clinical application with ADHD and convergence, with a case of ADHD and convergence. So he'll be discussing, they'll be discussing on 3 different pathologies and 1 remedy, understanding why man falls sick through the numerous video case examples. So we'll be coming up tomorrow with Dr. Yogesh Rajarkar sir and Dr. Sri Krishna Dhafle sir. That is 8th June, 6 o'clock. So be ready to learn from them. Also, let me announce you for day after tomorrow's session, which will be taken by Dr. Sunil Ghodke sir and Dr. K.Y. Dinde sir, who will be discussing polycrest, 1 polycrest, having 3 pathologies like blindness, ulcerative colitis, rheumatoid arthritis. Then they'll be discussing the evolution of polycrest remedy. They'll be discussing one of the novel remedies with its polycrest presentations, as well as they promise that you might start using it once in a week after his lecture, after their lectures. So I hope this would be a great session for everybody. Another session which will be on the last day, that is the end day of the webinar series with HHF. So that will be taken by Dr. Gopinath Menon sir, Dr. Pallavi Chaturvedi ma'am, whom I admire so much. I have listened to her so much, so many times, and she's one of the, I would say, experts. I could say she'll be discussing on ICU case of toxic epidermal necrolysis and interpersonal relationship, which is actually the theme of HHF, explored through a case of uncontrolled hypertension and renal failure. And they'll also be discussing evolution of lesser known remedy, which is a mixture of 2 polycrest. So I hope everybody is excited with the upcoming 3 days, and we all of you are ready to learn from each of them, all their different techniques, all their different patterns, and all the best they can give through these 3 days. So without wasting any more time, let me welcome Dr. Alok Kumar sir and Dr. Mayuresh sir with us. So let's start the session. I hope everybody is excited and ready, like yesterday, to listen to them and learn from them. So over to you, sir.
Thank you, Yashika. Everybody can hear me and I am audible. So good morning, good afternoon, good evening, and good day, whatever, because we have some international here. So yesterday we had a fantastic webinar and we enjoyed also so much, but it's difficult to say because with the crowd, but we'll try today to interact also, seeing your messages. So we have, so what we are going to do today, we are going to revise a bit in a short summary of whatever we did yesterday, because I think it's very necessary to make that link. So here you go. So we started with the first slide, what Dr. Kent said about the simplicity, that the language that patient tells us is all about the simplicity, and that simplicity should be a motto in our practice and everywhere, that we try to understand the patient as a layman. So this is slide. Not you, my PPT. Vision PPT. Not this. Not this. 1 minute. There is some. And And what we explained was why is it so why important to understand the mind of a patient. So we had some quotes from teachings of our stalwarts in which there is Dr. Kent, Dr. Henneman. So they are emphasizing why is it so important to focus upon the mind of a person to understand and perceive man. So we had some cases yesterday. So just here the slide number 7 is organ of 210, in which Dr. Henneman says that we are called on to cure the state of the patient's disposition, and that is to be noted. So that was the aphorism 210. And in 217, he emphasizes that the peculiar and always predominating state of disposition is very, very important to extinguish the disease. Slide number is 8. And then comes slide number 9, in which Dr. Kent says, by thus centralizing on a part of the body, you fail to grasp, and which is essential to the existence of homeopathy. And we had seen many cases of piles, the people who were there with us. So we didn't focus on piles, focused upon the person or the man. And then comes slide number 10, in which Dr. is morbid changes of the mind are the basis of the prescription. Slide number 10. No. Yeah. Slide number 10. Go ahead. Or again. Further. So this is the morbid changes of the mind of prescription. Any remedy not in this group cannot cure. We go ahead, and what Dr. Ken says, the study of man nature as to his life, as to his affections, underlies the true study of homeopathics. So all these pointers from our stalwarts, from our masters, are indicating to know in a patient where to prescribe and what should be the main thing to prescribe, what should be the main focus. Another slide, find the remedy for the. So we go ahead again. So this is what we discussed yesterday. Go ahead. So in which we first of all, you started with the case of coma, as you remember. And in that case of coma, he then you can come to the slide number 21, in which he by these 3 rubrics, positiveness, fight wants to, disturb, averse to being, the rubrics that we saw yesterday in the coma case, and that became the pointer. And coma case got cured. And then the very important thing that I wanted to emphasize was individualization. So in a case of Dr. J.T. Kent says that the manner in which he does business, the manner in which the disease affects the entire man, then you have something by how to individualize. So what happens, that's the very common scenario in our clinic. We have a case of piles, and we have some repertorial chart in front of us right after this. And this is the scenario on your repertorial chart. So what you do when you individualize, you have a man in front of you. We saw a case of sulfur in which reference. We go to the second right after that. You put reference, and you see that there are only 3 remedies coming in front of you. So you are in the direction of individualization. You put one mind symptom or the man in front of you that in such a terrible state, in the morbid state, he is giving you reverence during the pain in piles. You put one more symptom, and that is frivolity. For the past 2 weeks, he was having the bleeding, but he said it will be okay. He was not much worried about it. So he was non-serious about it. And you have right away, that is individualization. And then we saw a case of a person who was so scared, astonished, and he was in a way begging or praying, please take me out of this problem, because this 4th grade degree is nobody can treat it, and I'm going to be operated. So it is you who's only going to save me. So these were the four rubrics considered. We saw just an opposite case in which the patient was not scared at all. On the contrary, he didn't feel the pain. So that was the two different, completely opposite clinical conditions, and different two different men, same path reactions. And then we saw a case of Steffi Sagaria, in which the person was a victim of indignation, insult from boss, and he developed piles, and said that was the main thing upon which the prescription was based, because that was troubling him a lot. And then we saw a case of also the wonderful acting that we had, and in which the main rubric was illusions diminished, everything in room is diminished while she is elevated. So we described all these things yesterday. So today we are having some very interesting cases. I'd like to begin with how I was introduced to HHF. So what happened, I was came back to India in 2011. I was practicing in Belgium for a while, and I was introduced to this system. So I said, with mind only, how can we can treat a patient? So I said, okay, fine, let's see. So that's me. I had joined their 1 or 2 seminars, and I had one book written by Dr. K. Vaidinde. I have it here. You can. So this book I had read, and one patient called me incidentally, and she was a known patient to me. So she was completely bedridden. She was terribly in pain because she had backache, and backache had completely paralyzed her. She was lying on her bed, and she was in excruciating pain. She called me from Belgium, and she said, such is the state, I'm not able to work. And I called my GP, I called my nurse or house doctor, and he visited, and he gave me very powerful injections, but those injections are not working. He gave me, and he said that perhaps you need to get hospitalized. There was no relief in pain. So she called me and she said that I don't want to get hospital. So I asked her, okay, tell me what is happening in your life which is really disturbing you. And since I knew her from the past, she told me, and I knew a few about her family history, and I knew that she was going through a divorce process. So the interesting thing was, she told me that I have started living separately from my husband, and where I live, middle, so this is the row, and one street further lives her husband, and one street further lives her mother-in-law. So I asked, what is troubling you in this? She said, it is so difficult for me to come out of the house because I know that in one street further, this lady lives, mother-in-law, and one street further lives my husband. And she used a particular word. She said that I feel like a rat trapped in a rat trap. I cannot go here and there. He's looking at me, and she's looking at me. So when she used that word trapped, I said, oh my God, I have read it somewhere. So now I started thinking, and I had this software with me. So I said, okay, and I kept on continuing the talk with her. So this thing was very trapped. So I thought this is the best time to use the things that I have read in that book, because I had gone through that book. So I started only one link, and that was trapped. I didn't know much about the mind and how to decipher the mind. So I put one rubric, trapped, he is or she is. Let me check what is the exact rubric, because it was 5 or 6 years ago. Trapped he is. And I had these so many medicines in front of me. So what to do now? I said, I don't know much about it, So from her history, I knew that she was suffering from cryptotetany. So it's a very rare disease in which there are spasms, there are cramps in the muscle. So she used to have cramps all over the muscles. So that's what I remember that she used to suffer from. So I started going for the medicines and I said, okay, this medicine. And at one point, my eyes stayed and the medicine was pure. I didn't know anything about this medicine. What I knew was a new method or a new inspiration from this group HH and try it. I said, okay, this is the best time to try. So strychnine, I knew from Boric Materia Medica that is for muscular cramps. So if you go, you will if you go through Boric, you will come to know more about this medicine. I said, this could be the medicine because she uses this word trapped and she's feeling like a mouse trapped between these two people. I said, I can give her the medicine. So I asked her, okay, get this medicine, it's strychnine pure. Here it is, homeopathic to spasms of muscles and muscles cramps and all. So I said, okay, I don't have any other point to prescribe her. And inspiration in front of me to use this method. So I said, okay, let's go ahead. And I said, okay, get the medicine strychnine pure, 100 potency, and take it and let me know in the evening. So she got it somehow from the pharmacy there, and she calls me back with a lot of energy and happiness that she could, as soon as she took the medicine, within 15 to 20 minutes, she started working. When she could get up from the bed and she started working. So I didn't believe that. I said, what are you telling? Have you started working now? I said, can you stand up? Can you walk? Can you start working? I started asking her so many questions because I was surprised that how could this medicine, and I didn't know anything about this medicine. So that was my entry into HHF, and that made me, that shook my mind. I was so astonished that how could this work? And so I started exploring more. So this book, that was the first book that I started written by Dr. K. Vadinde, and his lecture is the day after tomorrow, and I'm sure that you will love his lecture. And so that's how I was introduced to HHF. And past 5 to 6 years, I haven't looked back, and I'm enjoying it so much. And I feel that the crux of homeopathy I have learned with HHF. That was my start. So here today I am with some cases of present scenario.
Dr. Alok sir,
Yeah.
if you are able to hear me. Yeah, sorry for interruption.
Yes, I can hear you.
Yeah, Alok sir, sorry for interruption, but audience are not able to hear you properly. There is lots of background voice and there is a voice distraction. So can you do anything in that aspect?
There could be the fan could be. How is it now? Can you tell me?
But today the voice is distracting. So many of the doctors.
But you didn't tell me. You didn't tell me.
No, it was absolutely.
That's fine. So many complaining that they could not hear me. How is the audio now? Can everybody respond?
Yes.
To Manish, please.
It is better than before. Let me ask from the audience, dear doctors,
Yes.
I believe that you are now able to hear the voice properly. Doctor, can you continue?
Okay, it's better now. I hope if anybody has questions about this rubric, delusion trapped, that was the first rubric, and then I remembered from Boric Materia that this medicine is very good for cramps. So that's how my journey started, and the patient responded very well.
Yes, it is lots better.
If you cannot hear me, I'm talking to the audience. If you cannot hear me, please respond, and Manish will take the necessary action and we'll do the things here. Okay.
So the voice quality is increased very much. So I think we should continue.
Okay, we're going to start. So I was just telling them how I was introduced to HHF and to this wonderful way of prescribing. So today I have two wonderful cases from I call them as a collateral damage done by COVID-19. So with the help of these two cases, explain a few things, and that is the slide, please. The last one, concern, adaptation, and reaction. Yeah, almost the last one. Trio of case taking. So we call it as trio of case taking. Go above. Yes, trio of case taking. Down. Slide number is 30. So this is the trio of case taking, and with these two cases, I'd like to explain what does it mean. The reaction, concern, and adaptation. So every patient that comes to us has these three factors, and they are very, very important. So patient will tell you many things, but the core concern of the patient, we need to know, we need to decipher, we need to ask, or the patient tells you himself. So nowadays, I'm sure in clinic we are seeing people, wearing mask and a lot of sanitizer and all. So I'd like to explain you the case in those terms. So nowadays, if you sit in the clinic, many people come to you. For example, a few days ago, a patient comes to me with a mask. He comes with a spec. He comes with a cap. He comes with hand gloves, and the gloves were till here. And when he enters in the clinic, he sanitizes his hands, and then he comes in front of me and sits half meter away from me. He asks for my sanitizer. Right? One type of person that says something comes, and he has his he comes, and I see that he doesn't have any mask, and then he remembers, sorry sir, I forgot my mask, and can I go and bring it? What does that show? Two different type of people, two different men in front of us. You see, that's how we understand a man. So the case taking has already started. He's sitting in front of you, and he's so frivolous that he forgot. Everybody nowadays is so, in a way, they would like to wear the mask. They would like to do everything 5 times before leaving the house, they think. But what about this man? And another man comes with like PPE, wearing the PPE that a doctor needs to wear. So this is the way we try to understand the man nowadays. So what happens? So these two patients didn't visit my clinic, and it was a telephonic conversation. But that explains everything. I'll tell you what happened. So this is all from a young girl who tells about her mother, and the mother is the patient, and she is a nurse, 53 years old. She's a nurse in a government hospital. And the complaint is that she's feeling irritation in her throat. And the main thing, the doctor told me that she has stopped going to the hospital. Why did she stop going to the hospital? Because she says that there are so many patients of COVID-19 infection. And what if I get infected? And my mother is so scared. So I said on the phone. So she started telling me that the scenario of the hospital is very, very bad. There are so many patients. I try to sanitize, but now I've given at home because what if I get infected? Okay, so is that the only concern of her? No. So I ask her, what is worrying you the most? She says that, okay, if I get infection, I don't have any issue. But what if my children, if my husband, what am I going to do? This is very important that my children and my husband don't get infected at all. And for that, what she has started doing, the paranoia in her. Fear of infection during this time of COVID-19 could be a normal symptom. Don't take it. But unless it becomes very, very, very predominating state of mind, then you should take it. And the main concern of this lady was that her husband, her family should not. And she had stopped going to the hospital, and she was washing dishes, washing her clothes every day, many times. And he secluded, she separated herself in a room, and she said that don't come near to me, otherwise you'll get the infection. So this is something that really was peculiar about her. And on the top of that, she said that, look, I'm having irritation, and perhaps I have COVID-19. You see, she was fixed about it. So here is the case. What do you think about it? We would like to on YouTube. We'd like to see your responses also. So please put it on, and we'll come to know, because we'll get some report. Okay. So in this case, what I concluded, that this lady, the main concern of this lady was not her, that the family is going to get it, and she was very scared about them, that they should not get infected. So the first rubric that I took, which is a very common rubric, caretaking people. She's a very caring lady. And the first rubric was, can you put it? Fear of the health of this. So that was the rubric that I took first. So it's coming on your screen. You can see fear about the loved ones. And I prescribed her the medicine in 1M directly, because the disease is very dynamic. Here it is, fear about health of loved persons, the first rubric. And the second rubric that I took, cares full of. She was full of care. What is she doing? My children should not get infected. They should not have any problem. Taking due care that I separate myself in a room. She washes the clothes. She washes and she started eating separately and all these things. So that is. And the second rubric that was very important was anxiety hypochondriacal. I have COVID. Does this symptom only says that you know? And she starts even feeling it. Can you open the clipboard, please? And that comes right in front of his carcinosin. A very simple case of carcinosin. Carcinosin 1M was given, and she could not fall asleep, because I have the verbatim here, and she started sleeping well. And she resumed the duty within 2 days, and the fear of infection was gone. Right? So this case, the similar case I got, in which the lady doctor, she complains that clinic nowadays, and what if I get infection, and if I give it to my husband, I can, what happens that people usually get quarantined. What if I get quarantined? I can manage, but what will happen to my husband? He even does not know how to cook. He knows only how to cook Maggi or egg. And what if I give him the infection? So this was the concern. I asked her, in the case taking, we asked, what else is disturbing you? What is the main concern out? The main concern of her was, she said that, okay, even if he gets infection, but what if cured, or after we recover, the society people, they are not going to leave us. And that's the main thing that was her main concern, apart from other concerns. So I took the first rubric, once again the same one, fear of health of the loved ones. And the second rubric that came as a main concern, that you cannot leave because of that person, that is fear of rejection from the society, fear of rejection. What will happen if I come back from the hospital? People are not going to accept us. And that's what is happening most of the time, that if a COVID-19 patient is declared, people to them. And once again, the remedy came, and that was carcinosin. So that's how. So in the first case, what was the adaptation? What was the reaction of the patient? What was the main concern of the patient? I hope you can point it out. These three are while case taking, and this will be elaborated by Dr. Mayur also later, and we will zoom it in so that you can know more about case taking. So now I have a very interesting case, and that it came to me like 6 or 7 months ago. And is somebody on YouTube? Because this case I would like to have a bit interactive. So this is a case of a lady. She is around 33 years old. And she comes with a very, very dull energy. She sits in front of me. And so this story is very, very interesting. You are going to correlate it with many of you. And if you're watching it on TV, or if you're not having your head, I suggest you better you should have headphone, because it's a sort of sensitive case, and you're not like that your children should listen to it, because many people wrote their children were also enjoying the acting of Dr. Mayur, and our expressions and whatever ow movement and whatever Michael ow pain wala nahi, dance wala Michael Jackson. So please have your headphones on. So this lady, 33 years old, comes to me. Her son is playing in the waiting area. So and the face was almost like this, and she starts telling me that is in a very, very terrible state. I asked her, what happened? Please tell me. If a patient starts telling you something sensitive, your tone also should become sensitive a bit. If lachesis comes in front of you, should also become lachesis. But this patient was very, very sensitive. And I knew that something really going wrong with her. So she starts telling that, sir, I'm in a very terrible state, What happened? I'm not able to fall asleep at all. I'm restless. The whole day, something is bugging me. So I said, what is bugging you? Sir, I am very happy with my family. I have a son. My husband is very loving, very caring. He gives me money. I am a professional. He allows me to go and work. Fine. But one thing that happened 20 years ago in my life is bugging me. What happened 20 years ago? So 20 years ago, I had an affair. And we got separated and I got married. It was all fine. But after that, those memories have recently started haunting me. So she's telling, and I'm just trying to listen to her, not to. My husband is fantastic. He takes care of me. Everything is fine, sir. But he's very cold. Cold means, sir, he's not romantic. He's a very good man, but he's very simple. He doesn't know how to cuddle. He doesn't know how to, what should happen between a husband and a wife. That does not happen in us. So, but what is the real trouble that you are suffering from? Sir, 20 years ago, the affair that I had, now I'm reminded of that every day. I dream, I sleep, I dream of that friend who was my boyfriend, and I always dream that I'm getting separated, and I'm crying, and I wake up in the morning this memory is so traumatizing that the whole day it tortures me. And that is not going out of my mind. Those moments that I spent with him are coming in my mind. And sir, the worst part is that I have decided and see him on Tuesday. I'm going, sir, because this should be finished off. I'm going to meet him once. And so I called my psychiatrist. So I asked help, whether he can help me. So he said that I'll help you. I can just give you some sleeping pills. Apart from that, I cannot help you. Perhaps you could see a counselor. So I called the counselor. I went. So counselor told me that the reason that these things are happening is because you are dissatisfied with your husband. Yes, I know, but what to do about it? Can you do something? No, we cannot help you with that. But counselor said, but what do is that you just go and meet him once and just come back. But it will be a very vulnerable situation because the things might go wrong and you are very vulnerable. Yes, I know. But sir, the counselor didn't help, the psychologist could not help. I don't know what to do. These memories in my head, I cannot get rid of them. The only thing that goes in my head is those memories spent with that man. And what should happen, sir? My attention should be on my child, whether he ate or not, whether his school bag is packed or not. But what I'm doing, I'm preparing for Tuesday, and today is Friday. So Friday, Tuesday, she has to go and see him in Nasik somewhere. But I'm going, sir. Definitely I'm going. I cannot stop myself. What should reality now? That I should be preparing the bag of my child to go for the school. But I'm preparing my bag to go and meet me. And I have written him. As the whole day I'm busy on my WhatsApp. He's going to message me or he's going to message me or not. And I messaged him. That thing is going on, sir. I don't know what to do. I don't know what to do. And then she breaks. She weeps. She starts crying. I don't know what to do. So this is the case. One very important sentence she said, I know it's wrong, but I cannot stop myself. What to do? So here is the case. Everybody, gear up. Start writing your interpretations and evaluation. What would you prescribe such? Would you ask him to go and see a priest, or would you like to prescribe him? Would you like to preach that please don't go there, otherwise the thing and the family will be broken? I'm very happy to share this with you because that shows the power of homeopathy, that with the help, with prescription, I could save a family to be broken. Could you tell me what is coming up on YouTube? My colleague is going to help me to say that what everybody is going to tell their interpretation, their evaluation. Comments are a little late. Comments are a bit late.
Amol, thinking of forbidden things. Is it thinking of forbidden things?
Thinking of forbidden things. Very, very nice. Very good. So there is a week. I think you would like to suggest for Plumber Metallicum.
Dhanashri Akhad.
Yes.
Ailments from celibacy.
It's from celibacy. Yeah, very good, very good. Ailments from celibacy. Yes, you can take that. But once again, I'd like to focus on of the patient and what is really troubling the patient. And what is the patient doing? You get a stimulus, there is some clinical scenario, piles or asthma or whatever. You're suffering from it, and what you do in get rid of that problem. How are you trying to get rid of that problem? Understand me? So the concern, what you want to get rid of, and what is the exact problem, and how are you doing it? Why are you doing it? Ailments from celibacy. Very good.
So
I think
what is the anxiety conscience of?
anxiety conscience of. Very nice. And I think everybody can show that many of you might be having such cases. Some more comments, please.
Samrin Sabah. Feel of patient is similar to Natramur.
Feel of patient is similar to Natramur. Natramur is into libertinism, is into naked wants to be in bed. You know, yes, it is close to it's close to Natramur, but
One past memory.
yes, in this, but you see, there is this rubric dwelling in the past disagreeable occurrences, or what is the rubric that is said? This one, past disagreeable occurrences. No, she agrees to it. She's enjoying those moments. Going in my mind, I used to be with him, the warmth, the moments that I had with this fellow, that I'm from my husband, although my husband is good, that is not leaving him. What more comments? Any more comments? I think we'll take 40 seconds or 1 more minute, because this should be a bit interactive. I think it's a in analysis and evaluation.
Shilpa, thoughts persistent, thoughts tormenting.
Thoughts persistent, thoughts tormenting is a very, in a way, generalized rubric that might not take you to the remedy, but but I think it's a good option. But in the direction of concern, what is the concern of that thing? There's definitely a duality, don't you think? That there's a conflict. That's what Hannibal was and Dr. Kent was talking about. The innermost of man, the conflict at the level of will. That's where the war is going on.
Amol Dige, she expects to be caressed.
She expects to be caressed, that's true. But is that the problem that she is going through? She wants to be caressed, definitely. But is that the thing that is bugging her a lot now?
Sureka Patil, easily falls in love, Ignitia.
Easily. Ignatia never falls in love in. So.
बहुत मेहनत लेनी पड़ती है भाई.
Ignatia is such a lady that, love at first sight may happen, but in order to marry her, you'll have to do 1,000 things. She's very, very sensitive to morals, and she will check you on every front.
Advita Kadam, the husband is cold environment, ailment from cold environment.
Dalkamara could be a good choice. Dalkamara could be a good choice. But is that the thing really disturbing her? What does she want to be cured?
Rajesh Latkar, love sick, antim crude.
Love sick, antim crude. But love sick ke upar wali cheez. This is sick. Love sick is always crying and tries to get attached with somebody whom he loves. But those warm movements, those romantic movements with this thing is disturbing with this fellow. I'd like to hint you now. Lovesick is a
Kalpesh Karmakar, antagonism oneself.
Antagonism. I wanted to hear that word. Antagonism with herself. Why is not anybody taking that rubric? It is a very, very important rubric in this case. But this is not the rubric that I took, but I'd like to explain you what is the antagonism with herself. 30 more seconds. If you have any others, please tell me. And then I'll reveal the remedy and my understanding that. Let's try to focus. What does she want at this moment? Of course, that love thing, that romantic, that warmth from her boyfriend 20 years ago is torturing her. And she wants to get rid of that. Fine. But for the moment, I know that it is wrong. I know that this is wrong, but what to do? He's coming in my mind. Take him out of my mind. I cannot help. She went to the psychiatrist. Psychiatrist didn't help. Counselor, you can go and visit him once and come back, but you're vulnerable. The things may go wrong. It's coming in my head. It's the superiority of homeopathy. Yeah? So there was a research done in Canada. Research was whether psychiatrists, psychologists, whether counselors or homeopathy, who can help better. And the research concluded that homeopathy it can help the best. And here you would know, here in such sensitive cases, you cannot start preaching that don't go and visit him, otherwise your family will be destroyed. Such things, patient is not in a state, knows it already. She knows it already, and that's the thing that is disturbing her a lot. So I tell you what I told her. Is there any comment?
People are saying Lilium Tick.
Lilium Tick.
Conflict of moral, Lilium tormented China.
Very good. China could not be, but Lilium. When I'll explain you, then the things will be very clear. So any other interesting? Now I think I can go. So the main thing in this case that was interesting was, what did she say? That I know that it is wrong, but what to do? She tried to seek the help from these 3-4 people. So first rubric finds the state of this patient is helplessness. So I took the first rubric, help. And the second rubric that was important rubric was, she was divided into two, right? I want to go there, but I know that this is wrong. This is the contradiction. So whenever there is contradiction, there is opposite force completely, which says completely the opposite thing. So first, the main date was contradictory actions are contradictory. So contradictory is the main rubric.
Doubleness of mind. Doubleness of mind.
Yes, doubleness of mind is there. Doubleness of mind is there. This is the rubric. Contradictory actions are contradictory to intentions. I know that that's wrong, but I cannot help it. I am going. She has taken the action. She has told him that I am coming on Tuesday to see you. She has taken the action. So when there is antagonism going on in your head, you're not taking any action. Should I do it or not? Should I do it or not? I'm doing it wrong. I'm doing it right. No, I should not do it. There is a state. She took action. She said, no, doctor, I'm going. I have to meet him. Tuesday, I have told him that I'm coming. So contradictory actions are contradictory to, right? And the third thing that was troubling her 24 hours a day for the past 1 month, which was making her desperate, was, somebody told, conscience anxiety. I know, doctor, that it is wrong, but I cannot help it. And go to the sub-rubric. Go ahead. Cannot rest. Rubric है ना, phosphorus का. Conscience anxiety does not allow him. I've forgotten the exact rubric. It's coming. It's soon is on your screen. अरे कैसे खत्म बंद क्यों? anxiety conscience of lying down, no rest night or day. So that defines exactly the state of this patient. And can you hook it up and show the chart, please? And she was given phosphorus. I gave her a dose of phosphorus 1 mg, and I asked her to sit in the waiting area and see me in 15-20 minutes. And I asked her, so she takes the 3 doses of phosphorus 1 mg and comes and sees me. So I asked her, how are you feeling? She said, doctor, I'm feeling as if I'm in present now. I asked, what do you mean present? I'm feeling much lighter. There was heaviness on my head, which is gone. And I thought, I observed that I started, so before taking the medicine, constantly busy on the phone, that when is he going to message me? I'm going to message him. What should I write him? So that was consistently going in my head, and that was driving. But when I took the medicine, I'm feeling a bit peaceful. And I thought about my kid. I looked at my kid. So as if I didn't have any connection with him. And I thought what I'm going to cook for him. So that was the change that was very, very remarkable. That is the priority for a lady who's having a kid. Instinct is that she takes care of the kid, but she was completely lost into this in which the conscience was not allowing her to rest not only physical, here and here. She was given phosphorus. Now the interesting part comes now. I didn't tell her to do anything. You do one thing, you take this medicine that will calm you down, you will sleep tonight better. That's what I'm aiming for. I didn't tell her not to anybody Tuesday or anything. I didn't say her anything. And I asked her, please call me on Monday and let me know that how you're feeling. So comes and she gives me a call and she says that, doctor, I'm feeling very well. I slept fantastic and I'm very calm. Everything is fine. And you will be happy to know that I emailed him that I'm not coming on Tuesday because I have my husband, I have my child. I'm not going to visit you. The relationship is over. So that was so satisfying me, because you see that there was a family going to be broken. Imagine if that incident had taken place, that lady perhaps could not forgive herself, you know. So homeopathy worked until that level. And I was just a witness to this. So the best part in this case was that I didn't intervene. I didn't preach her like a priest. There was a line I remember in which Dr. Kent in his lectures has said that a person who is sick in his conscience should be referred to a priest. And the person who is sick in his should be referred to a homeopathic doctor. But after learning this case, I would like to say to Dr. Kent's soul that homeopathic medicines can also work on the conscience. And by the way, this rubric was added by Dr. Kent. Can you check, Krishna, whether who added this rubric? I think it was Dr. Kent. Huh?
Which one?
The conscience, anxiety conscience. It was Natter. It was Natter. So it was Dr. Natter. So that was a very interesting case, and I was so happy. And I followed her up for two months at least. I called her just to know, because the medicine has acted, and I called her, and then the things were the same. She didn't go and she didn't visit, and I had given her medicine, that phosphorus 10 mg, that in case if you have this impulse once again for this, you take phosphorus 10 mg, and she didn't need to take it. So phosphorus 1 mg worked, and phosphorus 10 mg remained within her pocket, and she did wonderful. So and such cases will come to you also, and I'm sure that there are so many cases already there. So we have to find out the crux core, the concern of that person. The concern of that person was that she should not go there, and she had the desire to go there, but she should not go there. And the conflict, and she was completely helpless because of this, because this desire was completely bombarding on her. And due to that conscience rubric, she could not rest. She was in a desperate condition. So that was all about, and I hope you liked it. And this case might help you in many ways, in the form of rubrics and the cases that will come to you, because now cases are in abundance, and I have such more cases, but today one case is sufficient, I think. And I'd like to, is Dr. Mayur, are you ready? Yeah, so now it's a time. Our Mr. President of HHF to, I think he's getting ready with his presentation. And today he's going to take a wonderful case. Along with that, he's going to evolve a wonderful remedy in which he will evolve so many facets of that remedy. And after his presentation, you will start using that remedy once a week, once or twice a week. You will definitely start using it, because the evolution of that drug is amazing, and the case is amazing, and you will find so many people around you of that remedy. But that phase, or that particular remedy has not been evolved the way he's going to evolve. I have never seen such an evolution in ever about that remedy, and I'm sure that you are going to love it. Can I welcome Dr. Mayuresh Mahajan? Mayuresh Mahajan is soon going to incarnate on this chair, and he's going to he's going to present his wonderful presentation. So I'll take 30-40 seconds break, and I'm going to put the video off and audio off. In 30-40 seconds, Dr. Mayuresh Mahajan is here, and he will start his presentation. Thank you very much. Only 30 seconds, sir.
So, a very good morning once again. Hello. So again, the man in the disease, the process to understand the disease. See, yesterday we just gave some glimpses of so many remedies like opium, platina, sulfur, and we just gave one-liners or one sentences or some 2 minutes ka cases we showed or we enacted, so that how to understand the managed symptom and n number of adaptations. So what was the different reactions of the patient with one single disease, that was piles. Now the interest, how to understand the remedy in its whole extent. Everything should come into place. See, yesterday we gave hints of some rubrics, hints of some, events of that remedy, the PQRS of that remedy, the individualization of that remedy. Now let us understand how to take a case. No, see, sorry, how to take a case, everybody knows. But see, sometimes I told you yesterday only, I told, whenever you take everything, there is some part is which is missing. Now let us understand with the help of a case, all right, so that the science, the spirituality, the dynamicity will come together and see how beautiful it works. See, basically, a huge difference between a seminar and a webinar. When we, demonstrate or illustrate a case, video case, we have this video case delegates. We stop, we pause, and just try to show. See, that is the gesture which is very important. This is the now. See, because some hurdles, we cannot show you the video, but definitely we will do our level best to just feel of that remedy in front of you. And this remedy is very interesting. This remedy is very common. This remedy we have prescribed 1,000, but let us understand the journey. And this journey is amazing. I tell you, it's amazing. And you will find this remedy. Believe me, you will find this remedy day in and day out of your practice. Just like Alok said, it's a very common remedy. So, Dr. Dafre, shall I start with the presentation, please? Please start with the case. This is my master, Dr. our master Milind Rao. He has taught so many things. Yes, before I forget, yes, Dr. Mohanty sir, Dr. Gupta sir, a lot, many things in our clinics. Please, the next slide, please. Yes, it is a fertility and skin eruptions. So, this is a very interesting case. How I tell you. Slide, please. See, what happened was, I had a telephonic conversation with the patient's mother. So the mother was a patient of mine since years. And she used to tell me, I want to get my daughter to you. I want to get my daughter to you. I just wanted to show her. She is not ready to come to your clinic. This was what I'm talking about. And she told me that her daughter is suffering from skin eruptions and infertility since 10 years. In 10 years is a big time, but still she was not ready to come. That was something which was very, peculiar. Again, how to find out the man in the disease. This type to understand. There are so many infertility women who just run from one clinic to another for that to get conceived. But see here, the adaptation is different. The how is different. The feel is different. So from the beginning, I'm trying to give you the feel of the remedy, the essence of the remedy, the target. Okay, how to understand the case. So the mother had also informed about the repeated skin eruptions all over the body, and now imagine the patient is in front of us. Everyone, imagine in front of us. There are so many people, just imagine that the patient is in front of us. I would like to give you the exact feel of the patient. The patient was like, and just like this. Am I visible? Yeah. She was like this. Hi, doctor. So the next, now we'll be in the verbatim. We'll be in connection as of next slide, please. Yes. Yeah. This MSM is myself. Okay. How can I help you? So this is the best question to ask in front of a chronic case. If at all a patient is suffering from something which is very chronic, this is the best question to ask. How can I help you? See, there will be n number of reactions. That we have to understand. Yes, tell me, how can I help you? Name, place, that will be everything with the assistants, they do everything. How can I help? That gives the exact feel. What does the patient really wants? And there are 3 steps in the beginning. One is the body, what Rao used to tell. The body means that is the most tedious and long case taking, which has got weightage. And the end of the case, the tail is very important. Again, okay. So just be that with the patient. Ha, yeah, tell me, how can I help you? Yeah, tell me. So the patient is also really very, okay, this man is really interested in, treating me. This is the best. The connection starts with the patient. The synchronicity starts. So she said, I'm suffering from skin problems since so many years, doc. So, okay, many means how many? Since when? Then she said, see, the expressions are very, very important again. Okay, these expressions are very, you just can't, I can't recollect this. Maybe from my childhood. I never know. I just can't tell you. Since I was since child, I was suffering from this eruptions. Okay. Next slide. Next slide, please.
Sir, you're not audible. Sir, you're not audible.